Hi, my name is Dr. Kelly Wallace. I'm here to talk to you about deworming and dogs. Why is it important to deworm your dog? Worms are parasites, and we're talking about intestinal parasites. These are parasites that live in the stomach, small and large intestines of your dog. They typically get them from their environment. So just being a dog, eating things on the ground, in the dirt. They can also get them from their mother, nursing the first few weeks of life. Some of these parasites are transmitted through the milk, like roundworms. They can also get parasites from other parasites. So fleas carry tapeworms, and if the pet swallows the flea has the tapeworm. When the flea is digested, the tapeworm eggs are released, and that's how your pets will get fleas or get tapeworms from fleas. They can also get worms from eating other pests. So, like cats can get tapeworms from eating rodents, rats. Common parasites found in dogs are roundworms, hookworms, tapeworms, whipworms, and then coccidia. Roundworms and hookworms are the most common parasites we see in puppies, and those can be transmitted from the mom to the puppy through the milk. Coccidia is a protozoa infection, a single-celled organism, commonly seen in puppies and kittens. It causes really watery, yellowish diarrhea. Roundworms and hookworms can be transmitted to humans through the fecal-oral route. So if your pet licks its booty and then licks you in the face, you can catch them. Or if your pet has had a bowel movement somewhere in the house, and say your child takes their toy and runs it through the area that puts the toy to the mouth, they can catch roundworms and hookworms that way. Most importantly, roundworms. Roundworms infections are on the rise due to people having more and more pets. And roundworms in humans are not very good. They go to the brain and go to the eyes, especially in children. So we do recommend people with children, don't let the pets lick you in the face. Don't let the kids eat where the pets go to the bathroom, play where they go to the bathroom. Keep those things separately. Tapeworms are transmitted through fleas. So that's why we recommend flea prevention. The pet has to swallow the flea. So if your pet is on flea prevention, technically they can still get tapeworms, because if the flea hasn't bitten the pet to get the medicine to die yet, they can swallow the flea and the flea will contain tapeworms. But if they're on flea prevention, there's a less likelihood that they will have the flea on them to swallow it. So it's not a 0% chance by being on flea prevention, but it's a greatly reduced. How can intestinal parasites impact my pet's health and well-being? They're attaching to the lining of your pet's intestines, so that weakens the pet's immune system. Pets, young dogs or unvaccinated dogs for parvo are more apt to get parvo when they have intestinal parasites. There's a high correlation of intestinal parasite infections and parvo positive puppies, because the intestinal parasites have weakened that gut lining and immune system. They can cause diarrhea. They can cause diarrhea enough that it's hard to gain weight. Some pets, like hookworms, they bury deep into the intestinal lining and suck blood. I have seen puppies die from hookworms. It's called hookworm anemia. Severe infestations happening. Pets can have very swollen stomachs from intestinal parasites, a huge worm burden. Whipworms are the most common parasite seen in adult dogs, and they're hard to detect and hard to get rid of. They live in the large colon, or the colon. And there are some heartworm preventions that we give our pets monthly. Do have dewormer in medicine. And not all heartworm preventions are the same when it comes to treating intestinal parasites. Some only do roundworms, some might do roundworms and hookworms, some might do roundworms, hookworms, whipworms, and tapeworms. Some might not do any intestinal parasites. So it really pays to pay attention to what heartworm prevention you're giving your pet. Ask your veterinarian, give us a call. We recommend the heartworm preventions that get tapeworms, hookworms, roundworms, and whipworms as a good treatment once a month for heartworms and the intestinal parasites. Would you be able to see worms in your dog's stool? You can see roundworms. They look like a spaghetti noodle. Hookworms you cannot see. You cannot see the eggs. And tapeworms look like a little grain of rice or sesame seed on your dog's booty, you might see around the butt. And those are packets of eggs. So sometimes it can be that you have tapeworms, your pet has tapeworms, but you might get a negative fecal because those packets haven't opened up to release the egg. But now we do fecal antigen testing. So at our facility here at Catawba Heights Animal Hospital, when we send your pet's poop sample off, they're doing a visual look, a floating, a centrifugation floating, looking for the eggs. But they also do an antigen check, which is much more sensitive than a visual check, because it's looking for a piece of protein that is found on that parasite. So it's much more sensitive, and it's not uncommon for us to have a negative visual, but a positive antigen test. And you may have noticed now we're sending home fecal cups for clients, for you to collect your pet's stool sample for us, because the testing now is including more and more parasites. We can't collect enough poop on a fecal loop that we need a good 1 to 3 grams of fecal material to get a good parasite check. So we send those with you to bring back, so we can get a good reading of that. They now include antigen testing for coccidia and for tapeworms, which is new. What is the difference between natural remedies and over-the-counters compared to prescription medications? I'm most familiar with prescription medications. Over-the-counter dewormers just aren't as effective. They're not at a prescription dose. And a lot of times there isn't one dewormer that will get everything. One of the most common one is called Strongid that you might have heard of. Like, it's roundworms and hookworms. It's great. It's not going to get whipworms. It's not going to get tapeworms. It's not going to get coccidia. And another parasite that we see is Giardia, which can potentially have a zoonotic effect, which is humans can catch it. So it is very good to do, if you suspect your pet has worms, is to test your pet and then choose a dewormer based on the results. If it comes back negative, we usually recommend a good blanket deworming with the most all-in-one product that we have, Drontal Plus, or fenbendazole. But say your pet comes back positive for Giardia, neither one of those medications are going to treat it. We have to use other medications. And that's how that's how you choose the right dewormer for your dog, is by doing the intestinal parasite exam to the lab. We don't do the testing here. We send it to the lab because they're much more accurate than we are. And then we choose the dewormer based on what they find. And usually when you find worms, like roundworms, hookworms, the medicine only kills a certain age. So you wait again in 3 weeks to deworm again. And sometimes it can take several dewormings. And we might even have to change dewormers to get rid of all the worm burden in the gut of the dog, because there's a lot, and the wormer only gets a certain age of the worm. It doesn't get the little itty bitty babies. So that's why you have to have several dewormings as well. That's why it's also good with the heartworm prevention once a month that has a good dewormer in it. It also helps keep these at bay. If you have any question regarding your pet's health, give us a call, 704-827-0616.